Our first item of business today, we have Mr. Bill Webb here, Health Officer for Kent County, and Wayne Darrell. He's going to give us a COVID-19 update. Bill?
Thank you, Commissioners. Before I get started, I do want to mention to everybody who is watching remotely, I will be referencing a number of PowerPoint slides. The slides are available on the web page for download if you would like to follow along. At this time, we don't have the ability to sort of split screen the remote feed, so I think you may find it helpful as you watch the slides and listen to what I say. So, thank you. At this point, I'd like to praise all of our local partners in the COVID-19 emergency response in Kent County. Their cooperation and collaboration has been vital to the success of the effort. The health department could not have done what we have done without their assistance. It is a team effort, and we are grateful to have such wonderful people who live and work in the county working with the health department. I am pleased to report that this month's report will be more upbeat than last month. Since I last presented on July 21st, conditions across Maryland have stabilized. Starting July 25th, the number of new positives per day show a declining trend. Likewise, the statewide positivity rate has dropped from about 5% to just above 3%. On July 31st, Governor Hogan issued an executive order mandating face coverings indoors. He did this in response to rising case counts and outbreaks elsewhere that threatened to overflow into our state. This action and the widespread adoption of face coverings are making a difference. As the pandemic evolves, scientific evidence indicates that masks significantly reduce the rate of transmission of the virus. Nationwide, the alarming spikes in cases that appeared earlier have waned. As we move into the fall season, Maryland is making strides towards the next phase in the governor's roadmap to recovery. Kent County, fortunately, has been spared from the spike seen by our neighbors. Since our last meeting, Kent has documented 33 new cases. Okay, I'm too fogged up to see where we are on the slide, so you'll just have to make it up as you decide. Okay, so since our last meeting, Kent has documented 33 new cases. Virtually all of these positives have been tracked to community spread. Currently, we have 26 active cases with 228 total resolved cases. I'm happy to report that Kent County has not experienced a single death attributable to COVID in the last 5 weeks. In fact, it's a little bit longer than that. It's been since June 25th, so it's more like 8 weeks. I praise our healthcare partners who have successfully treated those needing advanced care. Heron Point's 3 recorded positives that you see on the slide involve staff members who were identified through routine weekly screenings. These cases represent a public health success. Proactive testing prevented the virus from reaching Heron Point residents. In the last 14 days, we have had 12 new cases as illustrated in the next slide. For those who are interested in total case counts by zip code, I present this information in the next slide. And for those of you who are looking at cases in the last 14 days, may ask, how do we have negative cases? And negative cases correspond to folks who have tested positive who were identified as Kent County residents who actually lived in Queen Anne's County or in Cecil County. You know, those folks who live across the river, who have zip codes that are mostly associated with Kent County. Okay, so back to zip codes. Here we go. Okay, if you're looking at the zip code slide, as you can see, cases are highest in Chestertown and those zip codes to the north and east. Those zip codes identified with an NA mean that they have 5 or fewer cases. They have not necessarily met the threshold for reporting cases in that zip code. Kent's 7-day average positivity rate is illustrated on the next slide. The pink line shows that we are consistently below the state average in the last 5 weeks. Our positivity rate consistently puts Kent County in the best performing quartile for this metric. That's very significant for this county to have a positivity rate as low as the one we have. So that's good news. Another measure where Kent is performing well is our percentage of population tested. At 26%, we have the 3rd highest rate in the state. We are doing a good job of getting our citizens tested, and that number demonstrates it. On the testing front, the health department's testing center at 514 Washington Avenue has been running successfully since June 10th. We test on average 130 persons per week. Appointment slots have been consistently filled for the Monday and Thursday hours of operation. Overflow capacity is now available at Chesapeake College on Mondays and Wednesdays, thanks to the efforts of University of Maryland Shore Regional Health. I take this opportunity to express my gratitude to Shore Health on behalf of the Kent community for standing up this testing site that will have the capacity to test approximately 250 people per week. Hospital utilization can be seen in the next slide. Statewide, the number of cases are gradually trending downward since late July. Locally, the hospital has consistently reported bed availability in both their acute care and ICU levels of care. At no time in the last 5 weeks have they had to activate their surge capabilities. Contact tracing continues to demonstrate that the greatest risk of becoming infected occurs from those who cohabitate with those who are infected. 21% of the new cases involved others with whom they lived. As the slide shows, parties, outdoor events, and other important avenues of spread, as illustrated on the next slide, include family gatherings, house parties, outdoor events, and other large gatherings. The highest risk location for Kent County cases include work outside the home, bars and restaurants, indoor retail, and outdoor recreation. This data clearly demonstrates how widely spread the virus is in our community. During contact tracing, the health department frequently reaches out to individuals who have no idea they've been exposed. For every positive we identify, we average approximately 2.6 contacts. Frequently, we experience difficulty getting people to answer the phone when a call originates from an unknown number. I implore all citizens to take any calls whose caller ID reports MD COVID or the number that is listed on the slide. This is the health department calling. We want to keep you and your family safe. Please pick up the phone. As a reminder, contact tracers will never ask for social security numbers, passwords, credit card information, or require you to pay to get test results. That's not the way we operate. If you are asked for that information, there's a likelihood that it is someone who is trying to scam you. So it's important to be aware of that. Okay, I'm going to change gears and talk about enforcement and compliance here. So enforcement and compliance efforts have increased significantly in the last 5 weeks. At the governor's urging, we have reassigned an employee to perform COVID compliance inspections on a full-time basis. He is proactively monitoring retail establishments and fielding all the concerns registered with the state about risky activity. Additionally, we have teamed up with the Kent Alcohol and Tobacco Inspector to work collaboratively with issues that he may witness. I am very happy to report that the overwhelming majority of Kent businesses are successfully complying with the requirements. I express my gratitude for the sacrifices they have made during these difficult times. As we move forward, the health department faces 3 significant challenges. The first is with school health. Since our last meeting, we have made significant strides with COVID plans involving the Board of Education. At this time, we need to fine-tune our outbreak response plan and operationalize our COVID practices into everyday activities. This includes both public and private institutions. I'm pleased to report that the health department has consulted with all 4 private schools as they have made plans for their fall semester. We have also worked closely with Washington College as they open this week or next with their fall semester. The second challenge that we face is disease surveillance. As schools and colleges resume, even in a virtual format, increased gatherings will occur. Whether it is off-campus parties at Washington College or neighborhood child care arrangements, this will translate into more cases with greater contact tracing complexity. So that's our second challenge. The third challenge involves preparing for a widely anticipated seasonal surge in cases. The health department plans to hold several large flu vaccination clinics in anticipation. Although the flu is not at all related to COVID, this effort will help reduce demand on our healthcare system. People who are not sick with the flu free up resources for those who may become infected with the virus. And the last slide, I wanted to give the commissioners an update on the public health CARES funding. Our CARES funding, we have spent approximately $276,000 on public health expenses this year. We project an additional $310,000 in salary expense for the remainder of the year. Also, it is important to note that the feds may permit rollover of unspent funds into 2021, even though the stated deadline is December 30th. Okay. So, in closing, Kent County sits in a fairly good position related to our neighbors. I'm grateful to be a citizen of Kent County and the way our community has responded to this emergency. I caution everyone not to become complacent. The COVID virus is outside, ready to spread mercilessly if we allow it. Our community's success will rest with the actions and personal responsibilities everyone takes. I urge all to please continue to wear masks, stay at home if you're at high risk, wash your hands, and keep your distance while socializing. Your efforts make a difference. These measures work. Thank you.
Thank you. Bill, I did have one question as we move into the fall and the winter and the flu season. Say a person has a fever and a cough. So how are we going to distinguish between, will the test, say if they have that, should they go get a test? So to see whether they have the COVID, or does the test distinguish between the two of them? Or?
So the test that we're performing, first and foremost, to answer your question and provide guidance to the community, if you get sick, please work with your primary care provider. You know, the relationship you have with that expert is going to provide the best guidance. But to answer your question, the test that we do only identifies the COVID-19 virus. could be sick and test negative for COVID. Now, there are other tests that can be performed that will identify flu just like we're doing with COVID. We are not doing, a teamed test as you're talking about at this point to figure out what the particular infection is. I can assure you that the health department is committed to providing testing services in the community for the foreseeable future, and that we are moving forward with our plans. And if testing is needed, we want to make sure that we're there for the community.
So would it be safe to say that, say you do have these symptoms, because with the COVID, I mean, and you can correct me if I'm wrong, if you don't do something, it could get worse fast.
Correct.
And so if you have these symptoms and you don't know whether it's a flu or if it's the COVID-19, you should go get tested.
Correct.
Is that a safe
Correct.
analysis?
Yes, I mean, I think that getting the test is there's no harm to getting the test. The advice and guidance that you have from your primary care physician is just as important, though.
Right.
So when cold and flu season hits, you could triple or quadruple the amount of COVID tests needed because people may go seek a COVID test just to make sure. Which means they're going to have to up testing quite a bit across the entire country probably.
We're looking at our options at this point for that.
Is it possible to have COVID-19 and the flu?
Yes.
So you could get a double win.
And we have had individuals who have had multiple infections.
Okay. It's very interesting. Any other questions?
Thank you very
Bill,
much.
we thank you. Thank you for the work you're doing. Wayne, do you have anything you want to add, or?
No, sir, except for your last question is that people should remember if they are having symptoms, that they need to isolate themselves. Whether they think it's COVID or the flu, don't come to work, separate yourselves from your family until you can find out whether or not you do have COVID-19.
That's very good advice.
But I'm available too if you have any questions for me. I don't have anything else to add to the bill.
We the citizens of Kent County appreciate the job you've both done, and I think the results that we're showing here in Kent County indicate that. I think everyone should be appreciative of.
I think we're very fortunate to live in
Yeah.
Kent County.